Hello, everyone. Welcome to our presentation today. And we are going to wait for some folks to sign on. We have a lot of people coming on to sign on and listen to our presentation on regenerative medicine today. It's a very exciting topic for us to go through and is getting lots of people help all over the world, and it's continuing to grow. And we're just going to, as you sign on, if you would just do us a favor and put out just the areas of the country that you're coming from. And if you're from outside the United States, please let us know. Of course, a lot of Philadelphia is coming through. Please just type it in the chat box. We have New York. We have another New York and New Jersey, Middletown, New Jersey. Excellent. We have Chicago, Illinois. My brother's from Chicago, Illinois. We have a lot of good doctors out in Chicago. I see Florida, Miami. Excellent. I see Richmond, Virginia. I see some more New Jersey. So just keep popping on there. As you come on, please just type in the city or the area that you are from, Doylestown, Pennsylvania. And we'll just begin to load up, and we're going to get started here shortly. My name is Dr. Bill Pizzello, which I'll again announce as we get some more folks back on there. Yes, we're live. Thank you for asking. We have been giving these presentations for regenerative medicine across the country. We have learned more and more about regenerative medicine, and I do believe that the best is yet to come as far as the conditions that regenerative medicine and stem cells will begin to treat. And so Northeast Pennsylvania, you're close to us. Very good. And just keep signing on. So again, my name is Dr. Bill Pizzello, and I work with a company called Lyceum Physical Medicine that's based in Philadelphia, which I'm assuming is why we're seeing so many people pop on from the Pennsylvania, Philadelphia, Northeast area. We also partner with a group called the Stem Cell Institute of America. It's approximately 600 to 800 offices across the country. Our success rate with these services we're currently doing is about 86%. And we feel in our office we see a little bit higher, but the national average is about 86% success rate. One asking what types of conditions. Today we're going to talk primarily about the knees, but there are lots of other conditions that the stem cells treat, of course. So as you just keep clicking on there, please remember that any questions that you have, if you answer in the chat, if I don't have time to answer them today, I will get back to you personally. You're going to receive, I believe on the next slide, my email address and my contact information that you can reach out to me. At the end of the seminar, if you stick around for approximately, I believe it's going to be about 30 minutes, there's going to be a really special offer that we only give when folks are taking the webinar series. So stick around for that and make sure that you participate. Participation is greatly appreciated in the chat box. If you can go into the chat box, if you have any questions, put them in there. And please pin where you are coming from. We like to see how far we're reaching across the country. I think so far that we have received Pacific Palisades, California. I believe that's out in Los Angeles area. And we already mentioned Miami, and we have up to New York. So we're kind of reaching all areas of the country today. Please remember again that I mentioned we are a partner with the Stem Cell Institute of America, and we have offices across the country. So if you contact me and you are located in another part of the country, we'll be happy to get you in touch with someone as we finish up here. We'll reach out to you and get you in touch with the facility close to you that can answer any questions or help you. Again, my name is Dr. William Pizzello, and we're with the Stem Cell Institute in Philadelphia. We're going to talk today about stem cell therapy and primarily how it helps to help people avoid knee surgery, get out of pain, and help with a lot of different joint and neuromusculoskeletal issues. It is a medical breakthrough that's recognized around the world. And I was just on a teleconference last night where one of the groups that we were speaking with, the lab, is working with the FDA. In case anybody has been watching the news lately, it's the FDA. And they are working on a help for cancer. So stem cells are going to be far-reaching. We're going to talk about joints and things today, but just know that as far as a cure in the future, it is the light at the end of the tunnel for a lot of folks, and I know that a lot of doctors are excited to get it to you because we have not had this in our bag of tricks for a while, and so it is definitely going to be something that is going to be revolutionary. And always contact me at info@lyceumpm.com. Our website for our physical medicine office is listed below, the one in Philadelphia, and our address is listed above. We're in the Roxborough-Manayunk area of Philadelphia, and I'll show you this slide again before we finish up. So, a new life. Please remember, today can be a very exciting day because you finally have the chance to feel better and end the never-ending pain cycle and get your life back. Today is an opportunity for you to change your life and stop the roller coaster of going to the doctor and going to physical therapy and going back to the doctor. And of course, opioids have spread across the country as a very dangerous way to decide to help your issues. Remember that things do not change. Your degeneration or arthritis does not change just because you're from the medications. You still have the same degenerated joint, and we're going to talk a little bit about that. So the purpose of the Stem Cell Institute of America is to help as many people as possible to get out of pain, maintain their health, to maximize the health for the rest of their lives. And stem cells do give new life. They just don't mask symptoms. So as I mentioned earlier, the medications that a lot of you are taking, hopefully a lot of you are not taking, but a lot of people are taking, are masking symptoms, as is the degenerative model for care, which we're going to talk about here shortly. So please, symptoms are the worst thing to go by to determine whether you are sick or you are healthy. Remember that heart disease, one of the first symptoms of heart disease is a heart attack. But we all know that you have heart disease and plaquing of the arteries far long before you had a heart attack, one of the first symptoms of heart disease. Just click for me a little yes if you understand the symptom analogy. Great, great, great. Thank you so much. And stem cells heal the underlying cause of your problem. They get to the root of it, they regenerate it, and they bring new life to it. So why are stem cells important? Once your body starts to degenerate, the process does not stop unless you do something to regenerate and halt that process from continuing to snowball in a degenerative manner. So for the first time in our lives, we have the ability through the magnificent use of stem cells to regenerate it and regenerate that area. Regenerative medicine is becoming a very popular area of medicine, and we utilize it not just for stem cells and joint issues, but for things even like aesthetics in the office. So arthritis. Anyone you want to type in there? Anybody been diagnosed with arthritis, been told they have arthritis? That didn't take long for everybody to jump in there. Yes, yes, I see some no's. No's are good. Arthritis is a very common, I call a quote unquote blow off diagnosis, because that is just inflammation of the joints. So when you go to the doctor tells you that you have arthritis. If you have pain in your joints, chances are there's going to be some sort of arthritis. So we just want to get a little bit more to the bottom of it. For the sake of this presentation, we're going to talk about 3 different phases of degeneration. And at the end of it, I'm going to ask you which one that you're in. If you have had knee x-rays, or if you've even seen spinal x-rays and want to take a guess at it, Phase 1 of degeneration, we're going to look at the knees. The cartilage in the knees softens. The cartilage loses its ability to absorb impact and is easily damaged. And of course, joint space, whether you're talking about the knees or the spine, the loss of, or the hip, loss of joint space is a big indicator. So this is a phase 1 degeneration. And if you're looking at the screen, you can see to the left of the knee, there's a space there in between the two bones, the femur bone and the tibia bone. And that space should be a little bit thicker there. But if you go to the right side of that x-ray, you can see how that's starting to thin out. Still some space in between there, but starting to thin out, and therefore a phase 1 degeneration. In phase 2, you can see how the bones are getting closer to each other. Now in that left side of the picture, our left side, you can see that that's almost what a lot of people are told at their doctor's office, bone on bone. Large sections of cartilage may wear away completely with time and over time. The joints begin to lose its normal shape as the cartilage breaks down. So you can see that that's closer together. I would say maybe that is bone on bone, but there is some space in between there, and that's phase 2. That's kind of in the middle. So again, I see somebody already answering that they have phase 2 degeneration. So they must be familiar with their films at least. And there's a couple of more, and someone says that they're worse than that. So let's see if this looks like that. Arthritis progression getting even worse. That looks worse. You can see again to our left of the picture as you're looking at it, you can begin to see that top femur bone digging down into the tibia and actually starting to change the shape of what we see. So when you change the shape and you see those sharp little tips on the end of the tibia bone at the bottom there, coming up on the side of the femur bone, those bony growths or spurs, or they're called bone spurs or osteophytes, and they form on the edges of the joint. Open cysts may form, and they usually happen near the joint, and bits of the bone and cartilage may float around in the joint space, and a lot of you have heard that. Someone already answering that they've been told that by their doctor. If you wait until this phase if you wait until you get to this phase, regenerative therapies are no longer a viable option. So we have a look at your x-rays and your MRIs when you come into the office. But if you've reached this point of degeneration, our medical director at our office, Dr. Dennis Boyle, will not perform the procedure at this level. So it is really important that if you are in a phase 2 degeneration or in a phase 1 degeneration, that you don't go, well, it's not so bad, I'm going to hang on a little bit, and you're going to wait until it catches up to this phase 3. Because although there might be some offices that will do it, we want our success rate to be very, very high. That's why our success rate is approximately 86%, because we do not let the area get to this, the bones, do the procedures when the bones are in this situation, excuse me. And remember, at the end of this, if you stick around until the end of this presentation, I'm going to give you a little offer where we may be able to actually take a look at your x-rays and see if you even are a candidate for regenerative therapies and regenerative medicine. Answering that. So the end result of that is knee replacement. Some people already think, now listen, I see people chatting in there that they're already at this situation. I would again encourage you to come into the office to take a look, or go into an office, or I'll lead you to someone. I know some people are tuned in from far away. So, but have a doctor take a look at it, because sometimes it is not as bad as you think. And knee replacement, unfortunately, is not. It would not be an option at that. But sometimes, unfortunately, doctors are giving it a little bit, what I think, too soon. So, a new you. If you could get rid of the problem once and for all, would you want to do it? In there, very good. You guys are very engaging. I appreciate that. It keeps it exciting for me. Remember, don't think limitations of degenerative therapy. Think regenerate it. So I want to talk a little bit about this. So in care, you have a couple of options. One is you can do degenerative therapy, and one is you can do regenerative therapy. So degenerative therapy is generally going to be your cortisone injections, your Suparts or Synvisc or Orthovisc or Euflexit injections. And basically what that's doing is it is treating the symptoms while the problem and that degenerative phase gets worse and worse and worse. So it is a different look when you're looking at regenerative medicine. So please, open your minds to another way of thinking when it comes to fixing your issue. We talked about symptoms earlier. Symptoms are the worst thing to go by. Does anybody remember the example that I used of when symptoms might be a bad thing to determine whether you're healthy or sick? Excellent. A heart attack. Exactly. So when one of the first symptoms of heart disease can be a heart attack. Cancer, some people say it takes 8 to 10 years before it can even clinically be seen at an office. So do not wait for symptoms to come about before you realize and do something about your body getting healthy. It's one of the worst things to go by, and what we do not want you doing is crossing from a phase 1 or 2 degeneration that we mentioned earlier into a 3 because your symptoms are just kind of okay, but you can live with it. The cost. So a little bit gruesome, the picture, but this is a knee replacement surgery. That looks painful, so I know that there's still pain involved in that. And you can see on the top there, again, the femur bone. As you get to the middle of the picture there, you see that big silver thing. That's a cap on the end of the femur bone. You see that plastic piece just below it, which is a plastic cap on the tibia bone. And then, of course, that round thing is what? Excellent. Kneecap. Excellent. So it's a kneecap. This is 3 to 6 to 9 months of healing and rehabilitation time. Remember, with knee replacement surgery, there's no guarantee of a result. There's a high percentage of failures and complications. Just ask anyone that comes into our office. We ask them if they know of anyone who's had knee replacement surgery. Some people do really, really well with it, but some people, and a lot of people in this case, we're saying 50% are going to need more surgery and are having complications. So I'm not going to get into all the complications of it now, but just remember this, that no surgery is routine surgery. If they have to put you under anesthesia, that is not routine for your body. So 50% or more need additional surgery after this, and the total cost of an uncomplicated case is $55,000, and much of it is wrapped up in deductibles and co-pays, and then your therapy costs and things like that. So a lot of people think because their insurance pays for it, well, I'll just go ahead and go that route. Scars down below, which I think are probably the least thing that would deter me from having knee replacement surgery. What's not built into this is the cost of your lost time, how your body is functioning, and the suffering that you're doing. And I know plenty of you have Googled replacement surgery and treatment for knees, and probably why you've gotten to this today. So in come stem cells. Exciting. Stem cells, those little cells off to the left there with the purple in the middle, are unspecialized cells that do not have a job yet. If you take the trail to the bottom, you can see how stem cells can become any other tissue cell in the body, including cartilage, meniscus, somebody's writing, blood, ligament and tendon, nerves, organs, and every different type of cell. So anything. They are even doing research now where they are getting tooth pulp stem cells from teeth that have an affinity for brain cells that they're using on people that have suffered a stroke. So lots of different uses for stem cells, and they are very miraculous. What's terrific about them is once they determine which type of tissue cell that they're going to be, they are very enthusiastic, and they replicate and replicate and replicate. And actually, how they know to stop replicating is they back into each other and bump into each other in a process called signaling, and they stop growing at that point. So stem cells can become any other tissue cell in the body, including bone, and then they will replicate themselves and kick out the old damaged tissue and bring in that nice new young tissue. So a big question that people have are where stem cells come from. I'm going to start off in the middle with that big red one there, embryonic stem cells. Most people, when they hear of stem cells, think that stem cells are coming from an embryo. So when we talk about embryonic stem cells, we talk about those stem cells coming from fetal tissue. Currently, that's illegal in the United States. They're generally derived from fetal tissue, like it says there. They are available in other parts of the world, but in the United States, they are not available. We haven't wrapped our laws around the morality issues and how we're going to control that. But we have sent people out to different areas to get those people that have the means to go and get those. And for a different conversation, but those stem cells are very active and very terrific in helping to heal all different types of conditions. The two types of stem cells that we commonly use, number one is adult stem cells. So people are always trying to wonder, you know, are you getting stem cells from fetal tissue? And I always like to tell them, well, we're not getting them from fetal tissue. We're actually getting them from you, the adult. So we can get adult stem cells. We can get them from bone marrow. We can get them from adipose tissue or fat tissue. And we actually do a procedure called PRP where we draw your blood and we spin your blood and draw the healing properties of the blood off of it once it's spun and separates and re-inject it back in. So we also are doing fat, bone marrow, and like I said, just to see if we can get a result from it, we will do it from just a regular blood draw like you're getting from the Red Cross. So adult stem cells. Stem cells, since stem cells from a young source are so active and they're more plentiful, we utilize stem cells from placental tissue or amniotic tissue. So I'll just read through here. It's allograft. A tissue graft is taken from the placenta of a donor who is concerned with the welfare of others. Obviously, it's a woman. Contains a high percentage of stem cells. It's from the uterus of legally performed C-sections and healthy childbirths, not Planned Parenthood. That's what people think about with fetal tissue, and that goes back to embryonic. Just remember this, with placental or amniotic injections, the mother monitored, healthy pregnancy monitored, healthy baby, and she is donating her placenta, which would otherwise be waste. She's donating that to help the welfare of others. Here's the difference in the two procedures. If you look at that tall, towering graph area there on newborn, that is the amount of stem cells in the blood that you will find in a newborn. So you can see that a young source, which is why embryonic people are trying to figure that out, because a young source for the stem cell is much more effective. Now, to the right, you see as you're starting to age as a teenager and 30 and 50 and 80 years old, the number of stem cells in your body go down. And so stem cells naturally occur in the body. If I rip my shoulder, my body brings in a lot of different healing properties into the area to heal that. We know that as we get older, we don't heal as quickly. If I did not have the newborn, the placental or amniotic stem cells available to you, I would think that the adult stem cells, which are represented by the other four categories there, the adult stem cells still would be a very, very, very good procedure for a lot of you. So we don't discount that because the graph shows this, but the placental stem cell definitely is much more effective. Placental stem cells better. So here's a couple of reasons. So placental stem cells are pluripotent, which means they have the ability to form all different types of adult cells. They can turn into everything. Adult stem cells are what they call multipotent, meaning they are a little bit more limited, but for the means of joint and knee and neuromusculoskeletal, more than capable of doing what we need them to do. This is just a quick picture of a bone marrow aspirate where they're taking from the bone marrow, usually at the top of the hip bone. An adipose harvest where they're going into the adipose tissue. A lot of people say that I have plenty of that, so maybe I have a lot of stem cells. It's not enough for like a liposuction procedure, but they are getting stem cells through the adipose tissue. Different in the United States, though. A lot of people have that question. But the FDA regulations for the clinical use of stem cells state that they can be minimally manipulated. They can't be changed. They can't be grown or cultured. The treatment must be performed on the same day. You can't watch the stem cells grow outside of the body. And stem cells are regulated similar to a pharmaceutical drug, and they have very strict guidelines. So again, the one that I always seem to look at is the treatment must be performed on the same day. In other parts of the world, we can take the stem cells and harvest them. We can actually watch them begin to grow. And once we realize that they are active growing cells, we can actually put those back into the body knowing that they're growing cells. Cells in and of themselves are not going to be able to turn into the different types of tissue cells that we want them. They need help. And so cytokines or cytokinins are the foremen. They tell the stem cells what to go, where to be, and how to act. So we want them to contain, we want the injections to contain a high number of cytokines. In the placental or the amniotic stem cells, we can monitor how much cytokine we're putting into the injection. So it tends to be a very high number. The rest of this underneath growth factors, I like to call this the miracle grow. If you were growing a tree and you put miracle grow on it, it would assist the growing process. So the miracle grow for the stem cells are collagen, growth factors, amino acids, carbohydrates, electrolytes, enzymes, all things that are helping the body to take those stem cells, helping the stem cells to grow. In the placental, although you do have them in adult stem cells when we draw your fat, when we use the injection from the lab, they can add these things extra into it. And a little note down at the bottom, no synthetic or engineered material, which we'll talk about. Placental stem cells are safe. Placental stem cells are collected from human amniotic membrane and fluid. Amniotic membrane and fluid have no antigens, and it does not cause rejection when you put it into the body. This is why you do not need a match. People have heard of stem cells when they talk about bone marrow transplants. Sometimes with burn victims, we hear about that. So when you hear about a bone marrow transplant, we had a person in our family that recently had to go to get a bone marrow transplant. You need to find a match. Because there are no antigens, there is no rejection, because this is completely from the baby side using amniotic membrane and fluid. Our tissue has been tested before and after processing to ensure it has 0 chorionic tissue, which is from the mother's side, and 100% amniotic tissue. 50,000 injections been done with about 1 adverse reaction. 8 facilities in the United States that can actually harvest the stem cells from the placenta. All the donors that we talked about, women are between the ages of 18 and 35. They're healthy. They have no prior use of medication or substances. A careful history is taken, and they monitor them through their pregnancy. Their blood is tested for any communicable diseases whatsoever. And the placenta is only obtained from healthy donors who are concerned with the welfare of others, and thus volunteer to donate their placentas. Something that I did not touch on at the beginning is that a lot of women are being asked, not a lot of women, I think I might hesitate it, all women are being asked if they would like to save their umbilical blood for the use of stem cells. So that is an option for anyone that you know going to have a baby, that they should investigate utilizing umbilical for up to 25 years. You can save that stuff for the use of stem cells. Again, multiple layers of testing. The donated tissue is tested before. Once again, on the final product, our procedures follow FDA guidelines 24 CFR 71 and the American Association of Tissue Banks rules and regulations, all evaluated by a medical director at the donor site. Placental stem cells are safe. They're clean, they're effective, and going back to what they said about nothing synthetic, they're not chemicals. This is not a synthetic hot lawyer commercial on the news next year. These are not chemicals, and therefore we really feel strongly about using them before injecting dangerous chemicals, even things like cortisone. So there's nothing left to chance with regard to your safety. Placental stem cells, out of the two choices, adult stem cells or placental or amniotic stem cells, the placental and amniotic are the best. That is what we try to speak to people about, and if you do have the means to get the placental stem cells, that is the best, and the other procedures definitely hurt a lot, and it is much more of a procedure, and the results are much better using the placental. Placental stem cells have the highest volume of stem cells. They have the highest volume of pluripotent, which means they can become anything, stem cells. Highest number of cytokines, which are the foreman telling the stem cells where to go and what to be. The highest concentration of growth factors, which is the miracle grow that I discussed earlier. You have zero chance of rejection, no surgery, no pain, and ultimately winds up being the most cost-effective without a doubt. So let's see what stem cells can do for you. We looked at x-rays earlier showing you the 3 phases of degeneration. Lots of people chimed in thinking that they were phase 1 or phase 2 or concerned that they might be phase 3, and we were unable to do the procedure. Again, in the next few slides here, I'm going to give you guys an offer and an opportunity that we do not give out that often, and you can see what stem cells can do for you. So let's take a look at these x-rays. So you see the x-ray on the left. These are 2 left knees. On the left, as I mentioned earlier, close to bone on bone, and then we can see at about 15 weeks, you can see the x-ray on the right, and you can see the space begin to develop, the space in the middle of the 2 bones. It's the meniscus or the cartilage in the knee. A lot of people come in telling me the doctor took my meniscus out or shaved my meniscus down. So that's something that we have to look at when you come in. But the results you can see there are miraculous. And do you think that person is feeling better? They are feeling better. You're right. This is a right, well, you're looking at it backwards, a right knee all the way to the left of the picture. And these are before and after. So it's a right and a left knee. Just look at the compartment. So look at the most left compartment there, and you see a little space. And then if you go over to picture number 2 on the right and look at that same area, you can see that it's beginning to develop space. And do that for each compartment, and you can see that just after 8 weeks, great results. Person is feeling better, and you can see a noticeable difference in how those stem cells are acting in that joint. Fantastic. This x-ray again, 2 knees on the left, 2 knees on the right. You can barely see a space. On the x-ray example on the left, this is 9 weeks later, and you can see the spaces developing on the right, and just pretty amazing in just a short 9-week time period. And again, the patient feeling terrific. Every time that we make a list of professional athletes that are big proponents of stem cell therapy, it continuously changes on a day-to-day, week-to-week, month-to-month basis. So when you look at people like Tiger Woods and Peyton Manning and Kobe Bryant, who's from this area, Alex Rodriguez, who I can't believe is announcing on the World Series, really terrific, and all these different athletes from neuromusculoskeletal. But when you look at Dana White, who is the president of the fighting, Muhammad Ali, Freddie Roach, both had Parkinson's disease. So they are using them to try to combat that issue. And but the current athletes are healing from receiving the stem cell injections in an incredible amount of time and able to play, where before they would be sidelined and on the injured reserve list for a long period of time. Now they're getting stem cell injections and popping back in and playing fairly immediately. I wanted to tell you about that. I forgot on that. I'll probably think of it when I go on to the next slide. So imagine, I did remember when I went on to the next slide. What I wanted to say is that if any of you are familiar with Tommy John surgery, a lot of pitchers now are avoiding Tommy John surgery, which is an elbow surgery that in a lot of instances, if it didn't go right, it was career ending, and now we're receiving stem cell injections and avoiding the surgery altogether. See, my memory's not as bad as I thought it was. So just imagine for a second, everyone's at home, you can close your eyes and imagine, but what your life would be like when you're no longer suffering. How you would change when you woke up each morning and how you would feel without pain. Think about your morning routine. How about your friends and family when they knew that you were feeling better, and not that they're concerned about you complaining to them, but were no longer complaining, and you were able to do things with your friends and family again and your kids again that currently you're not able to do. It's a big, big, big difference. And I just hope that you can imagine that, because this is now possible. Healing starts with a single decision. The most successful action is taken by people to get out of pain is the decision to make a change. You cannot do the same thing over and over and over again, thinking you're going to get a different result. You need a change. The time is now to see if we can help you and investing in. I'm just going to pop back over here for a quick second and load this offer for you. And you'll see there that we are offering, if you click on that offer to the right, we are offering an opportunity for you to come into the office and have a one-on-one consultation with our doctor. What I am going to tell you today is that if you fill that form out and we contact you and you are out of our area, we will have a phone consultation with you and even review your MRIs and X-rays without you having to come into the office to see if you're a candidate for the care. If we do that and we decide that it is a good procedure for you to have done, you can come up for the procedure on the first day. So we have the ability to do that now. In addition to that, what I will do is, if you have friends or family, or you yourself, I know some people chimed in at the beginning that they were from far away, but if you yourself are from an area that is far away, I will get you into that can help this procedure. So please fill that form out. When we contact you, you can, if you want the option of, and listen, the option for a phone consultation is only if you're more than an hour or two away. So, but if you need that option, or you need the option of finding someone else, please just let them know that after they reach out to you. So I always say people have three choices. That you do nothing and you grin and bear it and you hope that it doesn't get worse. And a lot of people make that choice. The other two choices that you have, actually, I had a slide at the beginning that I normally have in, but the red area is a degenerative model for care. More cortisone, more pills as you continue to degenerate, probably some Synvisc and Suparts and those types of injections along the way. But remember, that X-ray that you looked at initially does not change just because you're getting patch up of your symptoms. Those knees continue to look the same, and if you feel better for long enough, you will continue to degenerate. So you'll cross over into that phase 3 because you're just even feeling a little better. So that red area is the typical standard degenerative model for care, which we do and have done for years, but now we have moved into this regenerative area, which you see there in green, and the regenerative area allows you to regenerate the joint, for lack of better terminology, turn over a new leaf and choose a different path this time. We can work on other things to help the stem cells grow and to help ensure your success. So 4 reasons that you might receive stem cells right now. They only work if you get them. They do not work when they are in our freezer. They have to be injected into the joint area in order for them to begin growing. So it takes rather quickly for them to begin. Some people feel better within 48 or 72 hours, while other people it takes a longer period of time for the cells to begin to grow and for them to start feeling different. But the only chance that you have of them working is if you actually get them injected. The best chance of improvement is now. I'll reiterate what I said. Please, you have the least amount of damaged tissue today. Tomorrow you have more damaged tissue, and the day after that, more damaged tissue. Today, you have the least damaged tissue, and it would be the easiest, even though you're probably in a maybe phase 2, headed on to phase 3 degeneration, but it's the least amount of tissues that those stem cells have to go in and repair. Remember that life is about happiness and living. The better you feel, the happier you'll be. That goes without saying. You've probably already inhibited some things in your life because you weren't feeling so good. But remember, life is about happiness and living life. The better you feel, the happier you'll be. And there's nothing more important than your health. Not your car, not your house, not anything. So it's no longer necessary to be in pain and unhealthy. Think of how happy your loved ones will be when you feel better. So our gift, you see our gift off to the right. And our gift is an opportunity for you to come in and sit down and have a 30-minute consultation with one of our doctors. You fill out, it's a simple form. Once you click that button, you'll fill that out and someone will contact you very shortly. But it's the gift of health. And there's nothing to me like the gift of health. I've been doing this type of work for over 20 years now, and I've seen a lot of procedures come in, and I've seen nothing in the 20 plus years that I've been doing this, as with Dr. Boyle, our medical director, who is probably closer to 40 years. Nothing that has really excited people, and where we've seen the results, where people no longer have to suffer, like the regenerative medicine. If you mention that you signed up for this workshop and you decide to pursue it, if you take a look at this, there are many reasons why you would get multiple injections. Obviously, if you have 2 knees, but 1 injection, we're giving you a 10% discount on your first injection. If you get 2 injections, like I mentioned, 2 knees, 2 shoulders, a knee and a shoulder, 30% discount. That's pretty incredible. If you do 3 or more injections, and there are many reasons, if you just started counting the areas of your body that might have some degeneration and you might have some issues with, or have even seen a doctor about more areas, and again, the knee is 2 knees and 2 shoulders. So if there are 3 or more injections, we're going to give you a 35% discount, which is the biggest discount that we've ever given. And these huge savings, we're happy to pass on to you. If you fill out that form and you have to mention this offer that you participated in Dr. Pizzello's webinar, and you would like to take advantage of the discounted offers. I appreciate it. Did anyone learn anything? I was supposed to interact with you more on the chat, which I got excited with at the beginning and then fell off of. So can you just please tell me if you learned anything? Yes, I'm getting a lot of thank yous. You're very, very welcome. It's my pleasure to be able to do this. Absolutely. I think we can help without a doubt. We have to take a look at your x-rays. We have to sit down with you. If you're from out of state, we will do a free consultation over the phone. I see someone mentioned that they're in Delaware, and someone mentioned that they're actually in Richmond, Virginia. So just offer you that opportunity to be able to come in and do that phone consultation, or come in and sit down with one of our doctors. If you have any other questions whatsoever, please feel free to continue to pop them into our chat. And you can email me at info@lyceum.pm. And I truly, truly appreciate everyone participating. And I will talk to you soon. Thank you.